My name is Caitlin Brown, and for my case study, I chose to research the American Samoa tsunami of 2009. In this presentation, I will be covering the basics of the tsunami, how it was responded to by aid organizations, and how the people of American Samoa have recovered. I will also talk about what strengths and weaknesses were exhibited in the response efforts, and how to better serve this population in the future. American Samoa is a U.S. territory located in the South Pacific between Hawaii and New Zealand. It is located near a tectonically active area called the Tonga Trench. It is the eastern part of the Samoan archipelago and is separate from Samoa, which is an independent country, though most who reside in American Samoa are native Samoans. The capital is Pago Pago on the island of Tutuila. Because American Samoa is not a U.S. state, governmental organization can be a little different there. Instead of states, American Samoa is divided into administrative districts, subdivided into counties. Large family groups, called aiga, can have considerable political power and are headed by chiefs, or matai. District councils are called fono and are responsible for running local affairs. The U.S. Department of Interior currently has control over this territory. On the morning of Tuesday, September 29, 2009, a magnitude 8.1 earthquake on the Kermadec Tonga subduction zone generated a tsunami which impacted Tonga, Samoa, and American Samoa. Wave heights of 4 to 18 meters were measured in Tutuila. 34 people were killed on American Samoa, and $126 million in damage was done. Once American officials learned about the catastrophe, President Obama declared a major disaster in American Samoa and ordered federal aid to support local response efforts. This meant that FEMA, along with other federal agencies and military units, were required to go to American Samoa and assist in recovery. In the first 48 hours, first responders were primarily locals, FEMA, the Coast Guard, and Red Cross volunteers. By the 30th, FEMA had staff on the ground in American Samoa. The National Response Coordination Center, or NRCC, and the Regional Response Coordination Center, or RRCC, for FEMA Region 9, assisted with higher-level coordination of supplies and personnel to American Samoa. An Incident Management Assistance Team, or IMAT, which established an ICS, Disaster Medical Assistance Teams, or DMATs, and a Planning and Response Team, or PRT, were deployed immediately. The U.S. Coast Guard deployed a C-130 carrier carrying initial response personnel, which arrived Wednesday morning. The Hawaiian National Guard dispatched several C-17 cargo planes to bring supplies such as food, water, blankets, cots, communications equipment, and people. The USS Ingraham, a Navy frigate, arrived on the 30th as well with more supplies and helicopters. Some of the ongoing recovery efforts in the weeks after were supplied by FEMA and aid partners, including the American Red Cross, the National Park Service, the U.S. Army Corps of Engineers, the Small Business Administration, Save the Children, and Catholic Charities, along with local churches and schools where shelters were staged. The American Red Cross, in conjunction with 300 local volunteers, sent 97 disaster workers into villages with supplies called Jumpstart to Recovery kits. Each kit contained 2 blankets, a combination hand crank radio, flashlight and cell phone charger, a mesh laundry bag, a first aid kit, notepad and pen, work gloves, face masks, and a bath in a bag, all in a durable backpack. Bolts of fabric for making lava lava, a skirt-like garment worn by men and women on Samoa, were also delivered. The American Red Cross has corporate partnerships with UPS and FedEx, which were used to help facilitate delivery of supplies to tsunami victims. American Red Cross was responsible for setting up temporary shelters for those whose homes had been destroyed. These tents, or Yurts were designed for up to 6 people. Open-air shelters were also set up, serving everyone. American Red Cross also provided mental health care and child care services to families waiting to apply for FEMA benefits, and facilitated reunification services for families through the Safe and Well website. The response was directed by a joint field office, and Kenneth Tingman was the federal coordinating officer in charge of emergency response on American Samoa. However, there was no main ICS in place. Multiple organizations were using their own ICS systems, making coordination among responders challenging and ensuring differences in implementation of the structure. While several interviews and documents reference the ICS being used in the American Samoa tsunami response, I was unable to find any documents showing how exactly it was implemented, suggesting most of the planning was done on paper without being transferred to computers, as the above quote by Mr. Reynolds indicates. Emergency Support Function number 8 relates to public health response in disaster situations and supplies a framework used by support personnel to assess and deliver health needs and services to affected populations. ESF 8 directs involved personnel to assure the provisions of medical services, the continued operations of healthcare facilities, mass fatality management, sanitation and clean water availability, worker safety, behavioral health, and proper management of drugs, biologics, and blood products. The amount of need for these things is based upon a health needs assessment. In American Samoa, ESF 8 is administered locally by the Department of Homeland Security, the Lyndon B. Johnson Hospital, and Department of Health and Social Services. So how did response personnel carry out the functions of ESF 8 in American Samoa? First, the Department of Health and Human Services deployed medical personnel in the form of DMATs. Military medical personnel were also deployed along with the military response units. Once there, an initial needs assessment would have been conducted to determine what resources were needed and how to allocate them. The American Samoa Department of Health requested assistance from the CDC and US Public Health Service to conduct a CASPER, or Community Assessment for Public Health Emergency Response, both 5 days and 3 weeks post-tsunami. The Department of Defense provided soldiers to protect medical supplies, workers who were distributing them, and played a role in processing human remains and mortuary affairs. The Army Corps of Engineers provided skilled personnel to help repair water treatment facilities and restore power to healthcare infrastructure. The Coast Guard assisted in cleaning up hazardous material from Pago Pago Harbor, and the American Red Cross provided behavioral health interventions and reunification services. The results from the Public Health Needs Assessment conducted by the US Public Health Service showed that people primarily needed electricity restored, more sheltering materials such as tarpaulins, better provision of potable water, and increased access to healthcare services, as there is only one hospital and a few clinics on the island of Tutuila. People were also reporting getting drinking water from streams, which posed a risk of infection with leptospirosis and diarrheal illness. Animal vectors, such as mosquitoes, rats, and feral dogs were a problem, as more people were exposed to them due to lack of adequate shelter and repellents. Mosquitoes can carry dengue fever and malaria on American Samoa. Finally, some American Samoans reported an inability to get their medications or go to clinics for medical issues due to financial burden or lack of transportation. The death toll could have been much higher than it was. Many reports from American Samoa suggest that due to heightened awareness of tsunami signs, people took action to save themselves and others, which resulted in fewer lives lost. The earthquake which generated the tsunami was felt on American Samoa 17 minutes before the first waves hit. Once people noticed the sea receding from the shoreline, they set about waking up their neighbors and getting to higher ground. Afterward, many local community organizations took part in response efforts, including churches and schools, and local Red Cross volunteers played a huge role in helping in recovery. FEMA contractors built homes for victims, power generators were set up until power could be restored, and schools reopened on October 13th. The U.S. Department of Labor issued a national emergency disaster grant to assist workers who had been displaced from their jobs to find new jobs or receive retraining classes. The U.S. Army Corps of Engineers met with stakeholders in 2011 to draft the American Samoa Tsunami Study, a report of what happened during the tsunami, along with recommendations for better preparing residents for future such events. American Samoa has revised its emergency operations plan to reflect these recommended changes and updated hazard assessments. American Samoa also completed the requirements for Tsunami Ready, a program designed by the National Oceanic and Atmospheric Administration to help communities prepare for, mitigate, and recover from tsunamis. Finally, grassroots groups are working to prepare their communities for the effects of climate change in American Samoa, which may include more flooding events. As in any disaster response situation, responders encountered a number of challenges which impeded or delayed response efforts. American Samoa presented its own unique challenges. Not only is it a geographically remote island, the people have a different culture than that found on the mainland United States, and responders were forced to work through these differences to best serve this population. Some of the logistical challenges included things like the ICS systems not being implemented under a common structure. The tents provided by FEMA had to be replaced with sturdier yurts due to high winds. Supplies shipped in from the US were often delayed, and it would have been faster and cheaper to bring them in from New Zealand. Samoan family groups are large, as are the individual people, which led to housing shortages initially, as numbers and sizes of shelters needed had to be recalculated. And the public health needs of the victims seemed to overwhelm responders at times, who did not all know how to deal with them. In the course of providing disaster recovery services, several responders reported frustration with the lack of foresight in preparing for response scenarios in a culturally different place compared to the mainland US. Responders encountered language barriers, difficulties distributing supplies due to misunderstandings with village chiefs, anger from locals at not segregating men and women in the shelters, and handling social issues, which manifested as domestic violence and substance abuse. Future response efforts must consider how the local culture views sheltering men and women together, acquiring Samoan-speaking translators, and how to respect the local governing systems while getting aid to all who need it. Gender-based violence is a major concern in disaster response areas, and responders should receive training for screening victims and sequestering them to safe spaces. Altogether, the American tsunami response, while not perfect, demonstrated how a well-established and managed emergency response system can work, even for communities an ocean away. It also showed how mass education in noticing and reacting to tsunami warning signs can save lives, and how successful such campaigns already have been there. American Samoans have shown resilience and a willingness to learn, so future tsunamis will not be so devastating to them. Thank you.